Well, thanks. And thank you for inviting me to be here. And you're right. Today is a big day. It's not often that you can say it's a big day for the department and the state and the nation. But today does end the public health emergency for COVID-19 as declared by the U.S. Department of Health and Human Services through the Public Health Act. And I understand it's the end of the day today. So 11:59 on May 11th will mark the end of the public health emergency. This has been a far-reaching and massive event that has changed our lives over the past 3 years. And so Kara suggested it would be a good idea to pause and just recognize that we've been through a lot, both a significant public health event, but a significant social event as well. And for some of us, a personally tragic event. And so for you and for those of you that those that you've lost, I'd like to just take a moment of silence for a minute. Yeah. Yeah, this is a time that I'm remembering how it all began. And maybe since we're a small group, Kara, I don't know if people can tell their own stories here, but I'll start. I was working in the commissioner's office as the department's legislative liaison at the time. We had just hired a new public health director and chief medical officer named Dr. Ann Zink, and she was full of neat ideas on all the kinds of things she wanted to do to improve public health in Alaska. But very soon she was completely consumed by this alarming and confusing new virus. And I remember the confusion that was gripping members of the public and legislators, and how we were struggling to understand what exactly was going on overseas and down south. And I'll never forget how late one afternoon, the commissioner's special assistant came into my office and shut the door and said we needed to get on a call. And Dr. Zink told us that Alaska had its first case. That was in March of 2020. And days later, there were more cases, and the department was scrambling to pull together the protocols and the guidance about isolating and quarantining, what businesses were essential, what had to close. I remember interviewing for my job at SDS the same day that the legislature decided to shut down hearings. And by the time I actually started here in May of 2020, the division had done a lot of work already. The team here had applied for and approved for Appendix K flexibilities and the other authorities that allowed us to make quick changes to requirements in our regulations. The team was working to process new COVID money that was being made available. One of the first projects I got launched into was working on guidance for residential centers, nursing homes, congregate day settings to help people work through their day, continue to serve people as best they could, while also keeping people safe. And I got to know many of the providers through through the questions that came up, through the confusion that abounded, as people sought to stay open and serve the people they cared about. So I'd be interested in hearing stories that the staff at SDS bring, or any incidents that come to mind during those early days, or providers too, if anybody wants to share.
Sure. Does anybody have a story about the beginning of COVID that they'd like to share? Okay, I have a hand up from Ruth. Go ahead, Ruth.
I'm Ruth's husband, Ian.
Oh,
I thought
hi.
I'd share a perspective. I was the director of welfare and recreation for Fort Wainwright in Fairbanks when it came down. And I remember just a brief about military installations. The commander, usually a colonel, depends on the size of the installation, is basically the mayor of the city. So things get piped through the federal hierarchy, but at the end of the day, really that commander has the last and final say. So I just remember it was very, let's figure it out, build the airplane in the sky is what we call it, right? And when we first responded, we shut everything down except for childcare centers. So obviously the installation has all of these services for the soldiers and their families. So we kept the childcare centers open. Our social workers were sent home. Our restaurants and bowling and all that stuff was all sent home. We just kept the childcare staff. And then how are we going to handle children and how are we going to handle these symptoms? So the childcare system in the military is very strict, one of the best in the nation. And they already had a pretty good protocol on how to treat sick kids or how to identify sick kids. Now we're adding this extra layer of COVID. And then we start to talk about the impact of these lockups in very brief time, right? In a matter of weeks, we're talking about what this is doing to quality of life. We're worried about soldiers that are locked up in their barracks. So the commander decides to open up a restaurant with a sports center so the soldiers can at least get out. And then there's the face mask protocol, and then there's the sanitizing and the staffing, and where do we get all this protective equipment? And of course, all of the conflict that came with that, with the 500 employees that I oversaw, and how this is not part of my job, and where's my protective equipment for this? The federal government gives you a job, you're supposed to get protective equipment issued to you. And it was, I guess the best way to say it, you're building the plane in flight, and it was something else. And I wanted to share a good quote I remember hearing, and I can't give credit, I don't know who it was from, but they basically said that chaos, let me get this right. I forgot this stupid quote. Anyway, if I remember it along the way, I'll share it in the chat. But it was certainly quite an ordeal. And of course, we're hearing it from the federal side, from the national side, and then we're trying to implement that in Alaska, which is one of the 50 states that really has it the hardest. We're the furthest away from everything, and so quite an experience.
Thank you.
I, on the other hand, was on the other side of the spectrum. I run and operate an early childhood development center, and we got a good luck. Let us know if you shut down or not. That's all we got. So we had to stay open, fear-based, 100%. Everybody that came in and out thought they were going to get killed with this COVID, and you don't get vaccinated if you don't want to get vaccinated. You can't keep kids separated. All this, it was just mayhem the first 6 months for sure. So
Yeah.
Thank you.
Yeah, I was gonna talk about some of the silver linings here at the division. One of them, I think, for the country as a whole, is recognizing how much we value childcare and our childcare workers, and it seems like there's some real interest in improving pay, improving working conditions all around. So I hope that results in some real things.
Amazing story. Thank you. Damon, you have your hand up. Go ahead, Damon.
Yeah, I just want to briefly share. The funny thing is I was still in the military, deployed out of Fort Wainwright to Iraq when we first got the news. Now, we were in a pretty small location. So it was mostly just people from the States coming in, testing and everything. Well, there wasn't really much to test, right? We didn't have all that supplies out there. I remember when we first got the, face mask mandate or general order, we used 10 t-shirts or undershirts as our masks. And we all thought it was, silly. We did the 6 feet apart and all that. And that was about, I'd say, 4 months into our deployment, our 9-month deployment. And because of COVID, it extended us, an extra couple of months. I think in total it was just under 11 months when I finally got back to the States. And I recall initially when we left, obviously everything is open. Everybody went out and had a good time before we left. And you get back and it's just, okay, you're off the plane, get on a bus and go to quarantine. So we went straight from Fairbanks all the way to J-Bear here in Anchorage. And that's where we spent our first 2 weeks back home. But I remember the constant, updating of the general orders. This is, you can do this now. Or now we take that back. You can't do that anymore. You can't go to the certain places. Working remote is not a very good solution, especially with my job, what it was. So it was kind of just, hey, hang out in your room, and if we need you, we can only have X amount of people at the company. So it was very awkward because no one knew what to do. How do you manage, 100 or so soldiers and make sure they're doing what they're supposed to without any type of other communication except for over the phone. Yeah, right. So there was a lot of changes. And I remember when they were talking about the first vaccines coming to Alaska, and they were like, you don't have to get it, but if you want it, you can volunteer for it. I was one of the first volunteers to get the vaccination. Granted, there's a whole conversation about vaccines and you should get it, you shouldn't get it. I was like, what the heck, So I remember getting that. It was a whole thing. You gotta carry your vaccination card everywhere you go. That's inspectable item. Here, let me see that. You can't go home on block leave to your families until, like, especially if you live out of state. So it was a very difficult and awkward time, especially being in that environment. Luckily, obviously, it worked out. The whole objective was to keep the number of cases down. There would still be people who would go out and do something they're not supposed to, get sick. Now everybody has to get tested. But overall, I think things were maintained pretty well, at least on the federal side and the military side of things. It lasted, honestly, a whole lot longer than any of us thought. I can imagine everybody shares that same sentiment. We were like, it's not going to last more than, a month or two. And here we are just finally talking about the end, right? So yeah, that was really my experience, seeing that polar opposite of, we were just gone for a little less than a year and things are completely different.
Mhm.
Thank you, Damon. Okay, I don't see any other hands up right now. Tony,
Okay.
do you want to go ahead and keep sharing your messaging?
Sure. Just I was gonna, like I mentioned, I thought I would talk a little bit about the silver linings, the things that have emerged that we've learned and we've done. We've learned a lot about how we can safely do things like allow online certification for CPR and first aid. So place that into regulations. We refined other regulations to allow certain home and community-based services to use distance delivery methods within limits. So that kind of thing. And then we will soon be notifying our stakeholders about a change that we've been directed to make that was passed in a bill in the legislature just yesterday and is on its way to the governor, that comes out of one of the flexibilities from the pandemic, which was allowing legally responsible individuals to be reimbursed to provide personal care services under the Community First Choice program. So there'll be an announcement on that within the next, hopefully before the weekend. A lot of federal funding that was made available to the state has gone out to communities and agencies and other partners. About $8 million went to providers to try and help them be able to retain, recruit, enhance retention for their direct support professionals. And hopefully that has served as a little bit of a bridge during a particularly tough time to get people to do our work. And we've launched into what I hope will be a permanent fixture on the Alaska landscape. And that's going to be the availability of a DSP certification program at the UAA Alaska Training Cooperative, where our first cohort of almost 100 students is finishing up its first year of training and about to start its second year of training, getting certifications that they can keep and take with them anywhere they go, as they hopefully continue to stay in our field. So that is, those are a couple of things I think to feel happy about. Mostly I wanted to say thank you for our providers and for you on the training team, and Kat for and Anna for taking weathering through the pandemic together on behalf of the people that we're trying to serve. And I'm looking forward to the summer and warm weather and good health for all of us. So thanks, Kara. That's all I brought this afternoon. Appreciate you letting me speak for a minute.